Dr. Tom Catena is a missionary physician who has been working in Africa since the early 2000s. He first started his mission work in Kenya before moving to the Nuba Mountains in Sudan in 2008. The Nuba Mountains is a remote and isolated region with a unique mix of Christian and Muslim inhabitants. Dr. Catena's hospital in the Nuba Mountains serves a population of up to 1 million people and is the only medical facility in the area. The Nuba Mountains region has a history of conflict and violence, with a previous genocide against the Nuba people in the 1990s. Dr. Catena arrived in the region during a period of relative peace, but the situation quickly escalated into a civil war in 2011. Despite the danger and chaos, Dr. Catena made the decision to stay and continue providing medical care to the people in the region. The hospital faced numerous challenges during the conflict, including a lack of resources and staff. When the war broke out, most of the expatriate staff left, leaving Dr. Catena and a few local staff members to continue running the hospital. They faced a constant influx of casualties from bombings and other violent incidents, with severe injuries that required immediate medical attention. One of the most striking aspects of Dr. Catena's work is the resilience and resourcefulness of the local staff. Despite their limited training and resources, they were able to adapt and provide essential medical care to the people in the region. Dr. Catena and the local staff had to perform surgeries, including amputations, without the presence of an anesthesiologist. They had to learn and adapt to new procedures and techniques to save lives under extremely challenging conditions. Despite the ongoing conflict and challenges, the hospital in the Nuba Mountains has continued to grow and expand its services. They have trained local staff members in various medical roles, including nursing, pharmacy, and anesthesia. The hospital has also established a clinical training school for physician assistants and midwives, providing essential education and skills to the local community. Dr. Catena's journey to becoming a doctor in Sudan is unconventional. He initially trained in family practice and internal medicine, but found himself drawn to the surgical needs of the people in Africa. He spent 7.5 years in Kenya, where he learned surgical skills from experienced practitioners, effectively undergoing a second residency. His training was hands-on and challenging, but it prepared him for the unique medical needs he would encounter in Sudan. Dr. Catena also discusses the concept of palliative care in a resource-limited setting. He explains that while the hospital serves a catchment area of around 1 million people, many patients have limited access to modern medical care. In cases where surgery is not an option, Dr. Catena and his team provide comfort and support to patients and their families, often in the face of challenging medical conditions. The podcast also delves into the traditional medical practices and beliefs of the local community. Dr. Catena describes how the people in the Nuba Mountains rely on traditional remedies such as burning and cutting, as well as the services of local shamans or kors for healing. Despite these traditional practices, Dr. Catena emphasizes the importance of respecting the local culture and beliefs while providing modern medical care. The impact of Dr. Catena's work extends beyond the medical interventions he provides. He highlights the resilience and strength of the people in the Nuba Mountains, who have endured years of conflict and hardship. He shares stories of patients who have traveled long distances to seek medical care, often enduring days of walking to reach the hospital. The sense of community and hospitality among the local people is evident as they offer support and shelter to strangers in need. The podcast also touches on Dr. Catena's recognition by journalist Nicholas Kristof, who visited the Nuba Mountains to shed light on the humanitarian crisis in the region. Kristof's article in the New York Times brought attention to Dr. Catena's work and the challenges faced by the people of the Nuba Mountains. The story of a Muslim man proclaiming Dr. Catena as Jesus Christ reflects the religious harmony and respect that exists in the community, despite the ongoing conflict. One of the most striking aspects of Dr. Catena's work is the logistical challenges he faces. The hospital is located in a remote area, and obtaining medical supplies is a complex and arduous process. Medications and equipment must be sourced from Nairobi, 2 countries away, and transported through multiple checkpoints, often taking weeks to reach the hospital. The hospital's diagnostic capabilities are also limited, with access to basic tests such as urine and stool analysis and occasional availability of CBC and chemistry tests. The recent addition of an ultrasound machine and an X-ray machine has improved the hospital's diagnostic capabilities, but there is still a need for more advanced equipment to enhance patient care. Dr. Catena's experiences also shed light on the impact of the ongoing conflict in the region. The hospital has been bombed multiple times, and Dr. Catena and his team have had to take cover in foxholes to protect themselves from airstrikes. The emotional toll of living and working in a war zone is evident, as Dr. Catena describes the constant fear and worry for the safety of his patients and staff. Despite the immense challenges, Dr. Catena draws strength from his faith and the resilience of the Nuba people. He is inspired by their determination to persevere in the face of adversity, and it motivates him to continue providing medical care to the best of his ability. The podcast also highlights the critical need for resources and support to sustain the hospital's operations. Dr. Catena emphasizes the importance of connecting small organizations and individuals operating in remote areas with the necessary resources to continue their vital work. He also discusses the impact of the Aurora Prize, which aims to recognize and support unsung heroes like Dr. Catena, who are making a significant difference in their communities. Another important aspect of Dr. Catena's work is the focus on preventive care. He discusses the challenges of implementing vaccination programs and screening for diseases such as HPV and cervical cancer. He emphasizes the need for logistical support and resources to improve access to preventive care in the region. Dr. Catena also reflects on the minimalistic lifestyle he leads in Sudan. He shares his perspective on the value of possessions and the importance of detachment from material things. He discusses the impact of living in a remote and resource-constrained environment on his personal values and beliefs. Dr. Catena also discusses the cultural and social dynamics of the region. He explains the restrictions on dating and marriage, the limited availability of food, and the impact of the ongoing conflict on the daily lives of the people in Nuba Mountains. Despite the overwhelming nature of his work, Dr. Catena remains focused on the individual impact of his efforts. He emphasizes the importance of treating each patient as a unique individual and the profound difference that medical care can make in their lives.